Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Normal menstrual cycle. In normal menstrual cycle, there is sudden decrease in progesterone levels. Because of this sudden decrease in progesterone levels, there is release of matrix metalloproteinase enzymes, thus causing ischemic necrosis of endometrium, leading to endometrial shedding. This sudden decrease in progesterone levels causes vasoconstriction, thus prostaglandin F2 alpha levels are released, leading to increased myometrial contraction, causing dysmenorrhea or pain during menstruation. Thus, it is whenever there is dysmenorrhea or pain during menstruation, it is an indication of ovulation.
thank you and thank you for watching.